Okay, so no adventitious or abnormal breath sounds heard on assessment. Didn't hear any crackles or rails or anything that indicated the patient has any issues with respiration. So now I'm going to do a cardiovascular assessment. I'm going to be listening to the heart in several areas. Actually, for me, it's probably better if I stand on this side. So first, I'm going to listen at the aortic, which is in the right sternal border, at the second intercostal space. So we listen there. For you, this is your right side. Okay, I'm going to listen there, and then the pulmonic, which is going to be in the left sternal border at the second intercostal space. And then on the herbs point, which is at the third intercostal space, left side. Tricuspid, fifth intercostal space. And then the mitral valve on the fifth midclavicular line. And then we're going to listen to the apical pulse for a total of a full minute. And the patient's heart rate today for the apical pulse was 75. And also I forgot to state at the beginning of the assessment that the patient had a blood pressure of 145/79. Heart rate at that time was 75, temperature 98.7, and respirations were 16. So then for the rest of the assessment, we're going to do a abdominal assessment. So the first thing we're going to do is, before we touch anything, we're just going to do a gross inspection. We don't want to do any palpating, because once you palpate, you can actually make the bowel sounds hyperactive, and we don't want to have a false reading of what the bowel sounds are. So we're going to just look first, and everything seems to be normal upon assessment. There's no bulging. The patient, do you have any pain or tenderness in your abdomen?
No.
Both sides are symmetrical. I don't see any masses or lumps. The next thing that we'll do is we'll auscultate, and we'll listen for the bowel sounds for a full minute in all 4 quadrants, and we're looking for 5 to 30 bowel sounds in that time to be normal. So we'll just listen. Okay, bowel sounds were heard within the first 5 seconds in all 4 quadrants. So then after listening to the bowel sounds, if the patient was laying flat, I would just palpate and make sure that I'm not feeling any masses or tenderness, and ask the patient about any difficulties with digestion or anything like that. And the patient doesn't report any pain. Are you feeling any pain upon me touching your abdomen?
No.
Okay. So everything appears to be normal there. So then for the rest of the peripheral vascular assessment, I'm going to be checking the pulses in the legs. So I'm just going to be assessing the legs, making sure that there's no varicose veins, any kind of tortuous blood vessels. Do you have any pain in your legs or pain upon walking?
No.
Okay, so the patient doesn't report having any pain. So first pulse I'm going to try to assess is the dorsalis pedis. So I'm just going to run my fingers down the patient's leg and kind of see if I can find it there. Okay, and then I'm going to find it over here. Okay, I find it bilaterally on both sides, and then there's posterior tibialis. So I'm going to come down the patient's leg and right by the back part of the ankle and see if I can find the pulses on both sides there. Get a little bit more creative. And I did finally find it on both